Project 2025 is not just a political agenda. It's a direct assault on the healthcare system millions of Americans depend on. From the dismantling of the Affordable Care Act to gutting essential healthcare services for seniors, children, and women, this plan is a ticking time bomb. Project 2025 lays out a radical agenda, and we're here to break it down for you piece by piece. By the end of this video, you'll know exactly how to resist Project 2025 and protect the healthcare system that so many rely on. But first, make sure to follow us on all social media channels. Search for Turn Left PAC and subscribe. Our Resist Project 2025 reels are packed with the information you need to stay informed. Now let's dive in. Joining me today is Kimber Watson from Greeley Weld Indivisible, a fierce advocate for healthcare rights. Kimber, thanks for being here.
John, thanks for having me back. I'm really excited to be talking about the topic that we're talking about today because healthcare has been part of my whole life. That's what I've done the majority of my career. And so I'm really excited that we're talking about the healthcare on the Project 2025 and what it's going to do and how it's going to affect people.
Absolutely. And here it is, right here on the screen, on page 464. What we're going to be talking about today in our first topic, the Affordable Care Act, and how Project 2025 aims to target the ACA with the intent to dismantle it entirely. And right here, it talks about this under their legislative proposals. They want to remove restrictions on physician-owned hospitals, and they are blaming the ACA for these privately owned, physician-owned hospitals and clinics that they cannot compete with other hospitals in serving Medicare patients. Can you tell me, Kimber, how does Project 2025 aim? What does it plan to do with the Affordable Care Act?
Well, I don't know if you remember, John, but back in I think it was like 2017. They set out to do a repeal and replace for the ACA because they were going to give us a better insurance. And there was a bill that was put out on the floor to repeal the ACA, but they didn't have a plan to replace it. They just wanted to strip away as much of it as they could possibly strip away. And there was that iconic moment when they took it to the floor and when John McCain voted against his party and saved the ACA for us. If Project 2025 goes into effect, we're going to be in a lot of trouble. There will be 7.2 million seniors that currently have Medicaid who will not have access to the Medicaid. There's about 4.8 million disabled Americans that access Medicaid. These are to help them with their secondary to their Medicare. And so if they repeal, because they don't want to just repeal part of it, they want to repeal all of it. They don't like it, which doesn't make any sense because it was their plan in the first place. It just got tweaked. There's currently probably about 40 million children who have access to the CHIP program. Right. And if this is repealed, the children will not have the access to their health care. Another part of it is the fact that the ACA has made it to where people can have more affordable insurance, we were able to negotiate with the pharmacies to decrease some of the prescription plans that we have. And then there's a piece of the Build Back Better that we need to be concerned about too, because they want to repeal the portion that allows the government to negotiate prescription medications, which will affect millions of people. If they repeal this, we will have people dying because they're not able to get access to their medications. We'll have people who cannot no longer get access to insurance because part of this is going to repeal the piece that protects people who have pre-existing conditions. I don't know if you remember, John, but back when they had this bill on the floor to repeal the ACA, Jimmy Kimmel's son was born and he had a heart defect. And he was like, we need to fix this. We need to fix this. Well, when they brought out the bill, it didn't pass Jimmy Kimmel's test. So he was pretty angry, and I don't blame him. I mean, if you had a child that was born with a heart condition and then they want to take away the one thing that will make sure that that child's protected for the rest of his life under the insurance, that's like so wrong. And if they repeal all this, those children are not going to be getting their immunizations. We'll be back into like the 60s before we had as many. I remember having to stand in line just to get the polio shot.
Oh, yeah, I remember that too. And, and if we leave it up to J.D. Vance and Donald Trump, with all of their vaccine misinformation, yes, we're going to bring back polio, ladies and gentlemen. We're going to bring back diphtheria, typhoid, everything that was a scourge around the turn of the century. We can bring back here and just rebrand it under Project 2025 as something really great. They don't understand, and they are so completely out of touch with what Americans need, and that's the reason it is so important that we keep these people away from making legislation that's going to affect us, that's going to affect our families, that's going to affect our friends, our neighbors, and just everybody who's important in our lives. This is how important that defeating Project 2025 is. It's not. Project 2025 targets the ACA with the intent to dismantle it entirely, not just partially, entirely. Right. They want to strip away health care coverage from over 20 million Americans.
And you know what's really sad? The thing that makes me probably the angriest about all this is our representatives have way better insurance than we do as people. They don't care enough about the people if they don't want to make sure that we have the same insurance like they have. I mean, they have better coverage than any American individual. And that's like totally not right. It's like, okay, no, we're going to take yours away, but we're going to get more. We're going to have better.
That's what absolutely infuriates me. Let them, let's switch places for a day or maybe even a week and see if, and see if they could handle what it's like living in a real American household that they want to seem to micromanage.
Well, just recently I heard that MTG, Marjorie Taylor Greene, said that she wanted a raise. I'm like going, really? Because I get Medicare and I would really like a raise too. I'm pretty sure that the people that are on disability, Medicare, or Social Security, welfare, Social Security, or have low-paying jobs, I'm sure that they would all like to have a raise too. I mean, I'd like to make $100,000 a year, wouldn't you, John?
Oh, absolutely.
Yeah.
Who wouldn't? Yeah.
Right. Yeah. It's like, how can you sit there and say you want a raise when you have people in your country that are suffering because they can't afford to buy their groceries, get their medications, pay their bills, pay for their rent? I mean, we have such a high homeless population right now. That's not because these people aren't doing what they're supposed, their due diligence. It's because these people who are making the rules and the regulations are not paying enough attention or figuring out how to protect these people. So when we get to the Affordable Care Act, they want to take that away too. And it's like, wait a minute. If you're telling us you're the people's, you're patriots, well, you're not a patriot if you're going to take away my health insurance.
Oh, you're damn right. Not only would this strip away healthcare from over 20 million Americans, insurance companies would regain the power to deny coverage, impose lifetime caps, hike up premiums, especially for the most vulnerable. And since we're going to talk about the most vulnerable that brings us into the next portion of the segment. What would be the immediate effects on American families, Kimber?
Well, millions of people. This will be detrimental. People will be dying because they can't get access to healthcare. They won't. People who need medications like insulin, things to control their high blood pressure.
Exactly. There's going to be out just skyrocketing insurance premiums and crazy out of pocket expenses.
Yeah, exactly. And I mean, think about the kids. They won't have access to immunizations, preventative health care. Seniors, seniors and the disabled won't have access to the benefits they have now. We didn't, as a Medicare recipients, they didn't have access to a preventative health care visit every year. Now it's in the ACA, and it allows every senior to make sure that they get whatever immunizations they need, and to be able to get their medications, because of the Medicare Part D made it so it was more cost effective for seniors.
Exactly.
Yeah, it'll be a travesty. We'll have children that'll probably be dying that because they can't get access to the medications that they need.
This is what reality is like, in the real world, not in the golden towers of these people who are making these
Right.
rules for us and
Mhm.
trying to dictate how we live and how much suffering is acceptable to them because they just keep asking for more and more.
Well, I mean, think about it. One of the things that I remember how Trump mocked that disabled reporter.
Absolutely. Yeah,
You
that was
know,
despicable.
right. So if he can mock somebody like that, what is he going to do? I mean, he has even made a statement, and I'm not quoting him, but I heard it in a someplace. But anyways, but he had once said that like people with disabilities just need to be like, just get rid of them. What kind of person is that? I mean, they don't want to just, I was thinking about the other night, and I was talking to a friend, and I was thinking, they want to take us back to the 30s. They want to take away everything that FDR put into place, everything from there. But then I started thinking about it, and I'm like, no, 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 no. They actually want to take us back a lot further. They want to take us back to like I think it was 1873, 1873.
Yeah,
Um,
back to the time before vaccines and yeah.
Not just that, they want to take us back, and they want to bring out it, because I know we're going to be talking about this, but it will affect the women's health care. They want to put into to place this old rule from 1873 that will no longer allow women to get uh, abortions. Not by any means. They want to make sure that they can't even get it mailed to them from someplace, which is taking away their right to privacy. There's so many different like pieces of the healthcare thing that if they repeal it all, the whole country is going to be screwed.
Absolutely.
I have a better word, but I'm not going to say that live.
Well, maybe in the future we'll get our courage up and we'll just start dropping them left and right, Kimber, because maybe that's what's needed. You know.
Right. Yes, absolutely. I mean, I don't know. I've seen so many people who didn't have health care trying to figure out how to pay their health bills. And that's one of the things that we're really lucky about here in Colorado. You brought up how, the bill collectors would come after you for money. And Colorado made a rule that said, hey, no, you can no longer do this. If the patient didn't pay, you can't send a bill collector after them. They can put it on your credit, but they can't take you to court and sue you for it like they used to be able to. And I think that's really cool, because we actually live in a wonderful state. And there's 50 states, but you know what? My favorite state will always be Colorado, because I think we have the best laws for the people here. They actually care about the people. However, if we allow the Republicans to get into office, This is what they want.
That
They
will all
want to take
change.
all this away. Yes, exactly. Even here, if we have Republicans that get into office here in the state, they could try to implement these things too. We have seen what's been happening in other states, starting with Florida. Don't say gay, let's ban books, let's this, that, and then Texas taking away women's rights. I think they have the harshest ones, if I remember correctly. They want to criminalize doctors and women.
Children,
Mm-hmm.
especially those from low-income families, would be among the hardest hit with this. And Medicare, because Medicare covers routine checkups, vaccinations, and emergency care, and essential services that would be lost if Project 2025 is implemented. So it's these children could face a future where basic health care is out of reach.
Mm-hmm.
Project 2025 is a radical overhaul that could devastate our most vulnerable populations. But is this really what conservatives want? We're going to explore that after the break.
Today, we have an amazing show for you. Join myself, special guests, and celebrities. What's going on, Ice-T? Andrew Yang. Somebody else was hopping on. Oh, hold on.
What's going on, Battle?
As we roast GQP Jackaloons. He may not be a real businessman, but he is one hell of a con artist. That's what it is. That's what they got indicted for. Treason and sedition. And addresses the headlines of the day.
They must be held accountable.
Live streaming every night. I got more time in a friggin' court in a friggin' combat zone than you probably got in the military. This is Ojeda Live.
Project 2025's attack on women's health care is nothing short of draconian. It threatens to roll back decades of progress, defunding organizations like Planned Parenthood and restricting access to critical services. We're talking about birth control, cancer screenings, and reproductive health care, essential care that millions of women rely on. Kimber, let's talk about the specific threats that Project 2025 poses to women's health care.
Dang, John, I think you just said it all. I mean, think about it. They want to do away with IVF. I mean, so many women have been able to have children because of it, and they want to take that away from them. It's like, that's no fair. It's not right. It's just not right. It's like, if somebody wants to have a child, they should be able to have a child. The government shouldn't have any say in whether you can have a child by IVF or anything else. I mean, if they start there, what's going to happen next? Frozen embryos?
Exactly. The plan includes defunding Planned Parenthood, which provides essential health care services to millions of women, particularly in low-income and rural areas. It also aims to restrict access to contraception, maternity care, leaving many women without the resources they need to stay healthy.
Here's the thing. They want states to send information to the government about women who, like, about their, whether or not they had a back up, hold on a second.
A miscarriage. I saw that.
Oh yeah, on the miscarriages. Yes,
They'd
I'm
have
like,
to report
seriously?
that to the Trump administration. Isn't that insane or what?
Yeah, that is totally insane, which makes me go, okay, wait a minute. They implemented the HIPAA. I forget the year. I'm sorry. But when they implemented, oh yeah, that's true. But I'm talking right now. No, just kidding. But Google it. But I lost my train of thought. HIPAA is supposed to protect our health information so that nobody has access to it. We are the only people that are supposed to be able to choose who has access to our medical health records.
Absolutely. We should not have a legislator involved in the process, or your politician in the room when you're getting a checkup.
Right, exactly. I mean, the fact that they want legislation to look at this stuff, or, this stuff's got to be forwarded to the White House so the Trump administration could say yay, nay, or what. And we all need to remember that Trump did say that if a woman were to have an abortion, it should be criminalized. They should be criminalized. They should be put in jail for having an abortion.
That's something that we cannot forget that he said, even though he tries to deny everything.
Right.
That needs to be replayed and out on the forefront, folks.
Mhm.
He will absolutely try to imprison your sisters, your mothers, your daughters, your friends, your neighbors.
Doctors,
Yeah, he does not care. He does not
you
care
know,
about us.
this is one of the things too, is like doctors, they take an oath, just like everybody, like the government does. And it's the hypocritical oath to protect people, not do any harm. They are not supposed to do any harm. And by putting in these draconian laws, what they are doing is they're preventing these doctors from doing what their job is because they're afraid of going to jail. Women being sent to their cars while they're having a spontaneous abortion. I mean, seriously, we can't forget what used to happen before Roe v. Wade. Women were using coat hangers to abort children. And if something like that happened, they'd go to jail now. They would die maybe from some kind of bacteria or whatever that they got from a coat hanger.
Sepsis.
I mean, yeah, sepsis. Yes. I mean, seriously, it just makes me really angry. Really angry. Do you remember when they first passed that law in Texas and there was a 10-year-old that they had to remove from the state to have the abortion?
A 10-year-old.
A 10-year-old child that Texas, with their laws, wanted to make sure she could have that child. Now, we don't know what the particulars are about that, but if that child was molested or raped and those people wanted to make her have a child, that's beyond. It's just beyond. It's infuriating.
And that is exactly what the authors of Project 2025 want to do. Recently, I believe his name, Douglas Vogt, was one of the authors, was caught in an undercover video where this was brought up. And he differed from Trump. Trump at the time had said that he might favor, some, exceptions for incest and rape. But then the Project 2025 authors they don't believe in those exceptions. And Donald Trump and Project 2025 are pretty much one in the same. And women across the country are at risk. And without organizations like Planned Parenthood, many would have nowhere to turn for basic health services. And it's not only an attack on women's autonomy and their right to control their own healthcare decisions. Kimber, we're going to need to go ahead and finish up our topics here. Do we have any finishing or final thoughts on this?
I just want to remind people of one thing. Well, no, actually, maybe two. Okay. First of all, we need to remember who and wait, hold on a second.
That's good because I had the wrong screen on.
Okay, that's good. We have to remember that Project 2025 was written by 140 Trump administrators. These were people that worked with him and know what he thinks and what he says. And what they did was they took and they implemented this plan based on the things that he's probably said in his administration or that he wants. I don't think that any of this is not by design. It just is, and we have to remember who Trump is. Trump flip-flops more often than a goldfish, out of water. That man will say one thing and then the people don't like what he says. So he tries to flip it over and change the words. Donald Trump has always told us who he is and what he is. And we have to remember that when you point your finger at somebody, you got three pointing back at yourself. And Trump has proved that. He has proved that so well because he pointed his finger at Clinton. oh, she's, blah, 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 right? She needs to be arrested, blah, 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 put her in jail. Well, look what happened with Trump. How many counts does he have against him? How many indictments does he have against him? We have to remember that.
And it's not over. They're still going.
And the last thing is, Project 2025 is not a hoax. It is not a hoax. If people don't believe what we're telling them, I feel really bad, because we have been experiencing already all these things starting to be put into play. The judges with the SCOTUS, everything. It has been in design for such a long time. And we have seen things being repealed. And those things that are repealed are important things that have to do with running the management and running of our government, but it also has to do with people's rights. Every single person in this nation has the right to health care.
Absolutely.
And it doesn't matter who you are, white, black, brown, immigrant or not. You have the right to health care. And if you want to save your health care and you want to have access and freedoms to choose or do what you need to do for your own personal health, then don't vote for Trump, because 2025 will go into effect if he gets into office. We've got a lot to do over today.
Well, you're absolutely right. I couldn't agree with you more. That sums everything up perfectly. Kimber, thank you for joining us and for all the work that you're doing to protect healthcare. We said at the beginning that to defeat Project 2025, we must resist Project 2025. And here's how you can help. Visit turnleftpac.org and sign up for our emails. You can request a boilerplate letter to send directly to your representatives in Congress, telling them you oppose any cuts to the ACA, Medicare, Medicaid, and women's health care services. Project 2025 isn't just an attack on healthcare. It's an attack on the American people. The dismantling of the ACA, the privatization of Medicare and Medicaid, and the defunding of women's health care are all just parts of a larger agenda to strip away our rights and our security, and we can't let that happen. Project 2025 is a direct threat to everything we've built as a nation. We must stand together to resist it. Share this video, tag someone who needs to hear the truth, like and subscribe, and stay tuned next for Ojeda Live.